Hi, I'm Jimmo, and I'm a surgeon here at Rutland Regional Medical Center. I knew I wanted to become a surgeon when, in high school biology, I was intrigued by different anatomy and physiology projects that we had. When you break it down farther, in terms of what made me become a surgeon, I'm not sure I chose to become a surgeon. I think it probably chose me. Just because I've always been a very tactile, very visual, active participant learner. I've always learned most by doing, or by seeing, by doing, and then repeating. And has essentially been the mantra of surgical training for as long as anyone can remember. A vein ablation is when we replace actually taking a varicose vein or a faulty vein out of someone's leg and render it useless, but leave it right in place, so that the scarring is minimal, the anesthesia is minimal, and many times can be done in an outpatient office setting. It's really been a big advantage to patients to take a very painful procedure that used to need to be done in the operating room under general anesthesia with patients asleep and required a 2 to 3 week recovery time, and convert that into a procedure that can be done in the office with some mild sedation, and in 24 hours they're back to doing whatever they want. I think that's a giant advantage. In my mind, there are a lot of gimmicks in medicine, but that's the real deal. I think my best moments as a doctor oftentimes come after the fact, when someone has had something happen, and whether I've actually done anything or not, maybe just facilitated their way through the medical system or whatever, and I'll get a card on my desk or something from a thankful family member, and that's why, I think that's why you do it. Many times I hear, "Oh, what a great little hospital, down at where I'm from in Long Island, it's not like this." And I always tell them that this is a kind of a special place. Many hospitals in this country of this size don't have intensive care units, for instance, and such a robust set of other services. And as a surgeon, we need to employ many of those things many times because it's better for patients. People have a feeling that cutting and sewing and operating and taking stuff out is kind of what's important, and many times that's not always what's important. Many times I can do just as much good not doing anything and advising someone in a particular way and just being there for them. So there's a lot of different aspects to it that are all rolled into one. We call it surgery, but there's a little bit of internal medicine, there's a little bit of psychiatry, there's just a little bit of just being a friend.